Assalamu alaikum and greetings to you. I'm Zulfa Brown Jabbar from Wives of Paradise and Education Foundation, committed to holistic health and wellness. September is celebrated on this glorious day, wonderful sunny day. September is celebrated as the month that heralds the spring season, as well as Cervical Cancer Awareness Month, which is commemorated annually to encourage women to do screening to prevent cervical cancer. And today we're in conversation with Patricia Dutoit, Business Development Manager from Hamadi Labs, and Dr. Shamila Suleiman from Gatesville Family Practice. Good morning and assalamu alaikum to you ladies.
Walaikum
Good
salam.
morning.
Patricia, tell us a bit about Hamadi Labs.
Apologies as I corrected. It's Priscilla, actually.
Priscilla.
Yeah, no, don't worry. Hamadi Labs, we've actually grown over the past 12 years to, let's just say, we're my fourth biggest lab currently, pathology-wise, within South Africa. We've got 9 laboratories, which is a national level. We've actually just opened up overseas as well, and then 100 collection points, meaning that is doctors and healthcare facilities we have gone into partnerships with in order to give affordable, not just on the pathology side, but also affordable GP and consulting fees. So that's where we come into it.
Dr. Suleiman, tell us about your family practice.
So, as you mentioned before, the practice is called the Gatesville Family Practice, and we are right on Klipfontein Road, on the square where the big market is, on a Saturday morning. It's a practice that I run with my husband. So I do mornings and he does afternoons, and we split the practice in that way so that we can provide a comprehensive service. Patients can decide whether they want to see a female doctor, whether they want to see a male doctor. It is, as I said, a family-run practice. So we see general medical patients, we see adults, we see pediatric patients. I have so many elderly patients also well into their 80s, 90s. And we provide, as I said, a comprehensive service. We do minor procedures. My husband does circumcisions as well. So we try to give the community as much as what we can in an affordable way. We also I run a free diabetic clinic once a month for anybody really. It doesn't have to be a patient of mine. If you want any information about diabetes, if you're worried about having diabetes, or if you have it and you need some assistance, we are more than happy to include any patient really in that clinic. They just need to contact the practice. And we've started about 3 years ago. It was a very old practice that we took over, and alhamdulillah, it's been building very nicely.
Great. So today, what I love working with you two ladies is that you're extremely accessible and affordable. And our topic today is specifically Cervical Cancer Awareness Month. And tell us, Dr. Suleiman, do you perform pap smears at your practice?
I do. I am really trying to educate the women in the community that they don't need to book a gynecology appointment to have a pap smear, firstly, and also how important it is to do pap smears regularly. So definitely we are on a very serious drive to get the awareness out there.
Okay, Priscilla, tell us how Hamadi Labs is committed with this campaign.
Well, the campaign that I actually started this already because I'm based in Joburg. We've actually started it already in Joburg about 4 months ago. So it just started as like a general wellness in and amongst corporate women because they just don't get time. Then it's just escalated. In the month now of August, we did almost 1,200 pap smears nationally with communities. So we went out, we educated them, and yeah, so that was quite a successful campaign. Now, obviously, due to this month of September, we've decided to further extend our pap smear pricing in order to get further in other communities. And that's how we obviously came across you, which we do appreciate this opportunity. I have then, I know that on the screen you can see that the pap smear prices, but I do have some good news and some partnership news that I wanted to share with you. Is that the pap smears, which is the normal slide pap smears, which we will discuss later, we've actually reduced, and we'd like to give it out to the community and to everyone that is listening and the doctors that you are supporting at not 138, but 68 Rand. That's
Yeah,
half
I've
price.
definitely seen this is a need in our community. As so many women are not aware that they can actually have a pap smear at their GP, number one, and number two, they're not aware that they have the right and the choice to decide which lab to actually have the specimen delivered to, and where there is, and that price is extremely important, of course service as well.
Correct.
So tell us, ladies, why is a pap smear so important, and who should be going for a pap smear?
So any woman really that is sexually active, regardless of age, should start to have pap smears. And it's important because it screens for cervical cancer. And one of the common causes for cervical cancer is human papillomavirus infection, or more commonly known as HPV. And this is a very big risk factor, particularly in women who have HIV as well. It's highly prevalent. And it is something that needs to be monitored because of this risk. So pap smears, regular pap smears are very important. Cervical cancer is easy, not easily, I wouldn't say easily, but it is one of the more easily treatable cancers available. So early screening is very important to pick it up and to get treatment. And then obviously the women who go through the treatment, inshallah, they will, be able to beat the cancer. So that's why it's important to have pap smears.
And it's a fairly simple procedure, doctor.
Very simple procedure. It involves a little bit of discomfort. I always say to my patients that it shouldn't be painful unless there are other factors, involved. But generally speaking, it's not a comfortable procedure, but it's not painful. In my practice, I usually explain the entire process to the patient before we even put her onto the examination bed. So what happens is the woman obviously needs to remove her clothing and she will lie on a bed. And then I do an internal pelvic exam just to check if there's anything, that I need to be specifically aware of, and also to look and see what the orientation of the anatomy is for that specific patient, because every woman is different. And then
Yes.
and then after that, we insert a little device called a speculum. Looks a little bit like a duck's beak almost, and it comes in different sizes. And we use that to open the vaginal canal up, to open it up, and then visualize the cervix. And then we take a little brush, and that brushes the cervix and collects the cells from the surface of the cervix, so that is what is going to be tested. And either we put those cells onto a slide, as Priscilla mentioned, which is a simple glass slide, and that gets looked at under a microscope in the lab. Or there's something else called the liquid-based cytology, which has got a special medium in a little container. And we just take the tip of the brush off and place it in there. And then that goes to the lab, and the solution with the cells in it gets tested.
It's very encouraging and comforting that you say every woman is different. So it's the same with every doctor as well. The bedside manner is so important.
It's
And I
very
know that all doctors go and study physiology and anatomy, but it's also for me and personally, I think for a lot of the people that we are speaking to, women also, I think they find it very important also that the doctor specifically not only understands physiology and anatomy, but also the female body and the emotions and all of those kinds of things that come with it. So, from your side, Priscilla, What happens at the lab site, and how clued up is your team to come and collect all around in areas in Cape Town? Where are you based?
So, like I said, I was going to give you a list of where we're based until I realized we actually cover Cape Town quite well, very, very well. So I would like to share that you can see on the screen that there is the Cape Town landline number. Otherwise, they could
Okay.
easily just WhatsApp me, which I would also share that. And there is a WhatsApp helpline number, because just alone yesterday, we are growing even further. We've spoken to most of our partners. We are very accessible in all sorts of places. We are taking a step further that we do assist and do events at community centers. So if there is, whether it be doctors or midwives or whoever that wants to put a function together, we will happily come and attend it. We'll bring our own nurses, and we are there definitely for the community. Cape Town is not where it begins and ends. I mean, this is a national company. So with this inspiration of this pap smear and wanting to assist, we're looking to grow further. Regarding our team of collections, like I said, we've got 150 points of collection. Doctors can just give us a shout. We're there within the same day. The turnaround time is within 48 hours. The results go to the doctors. So from the lab's point of view, we just directly give information to the doctors, and the doctors will then obviously give patients the feedback from there. I lost. I think I've lost someone. I think, Doc, it's just the two of us now.
No, okay. Well, I mean, I can a little bit of additional information. Generally speaking, women need to have pap smears every two to 3 years. I know in the States, the protocol is that you have your first pap smear at age 30 and then 10 years, after that. And that's based on information that the protocol policy makers looked at in order to look at what is the most effective, both clinically for the patient and also cost effective protocols as well for the state, the treasury. But I think ideally any woman from the first time that they are sexually active, they need to start having pap smears at least every 2 years, if not every 3 years. And particularly women after they have children. At your 6-week checkup after you've delivered your baby, you then need to, it's very important that you have a pap smear as well, because all of these hormonal changes can affect the cellular structure of the cervix, and that can cause abnormal cells. So it's important to get that surveillance done so that we know what we're looking at, if we need to repeat the pap smear. Sometimes if it's for example, if it's an abnormal result, there's different classifications. There's a whole classification table about what the significance is for the different abnormalities that are found. And sometimes they will say you need to have an additional procedure to look a little bit deeper at the cells of the cervix. Other times they will say you need to repeat it in 6 months or a year. And other times it'll be a normal pap smear. And then, as I said, every 2 to 3 years, it needs to be repeated. It is an issue in the state, I think, because I've got a lot of young women that are coming to me saying that they want a pap smear. They went to the clinic or the day hospital and they were told they have to come back when they're 30. So there's definitely a gap in the system in terms of access to this for women younger than 30. So it's very important that they do know that they can use the services of GPs, and that there are laboratories like Hamadi Labs that make it quite affordable for them to access the service.
See, Doc, that's what I was actually going to ask you as well. I know totally off the topic. Like if the clinic is saying 30, we've had now incident, like we with a certain group of midwives and that as well. And the women that are having babies younger these days. I mean, I had my kids at 19. So how, I mean, it wouldn't be fair for me to be sitting waiting until I'm 30 if I've had both my kids. So I'm
No,
glad that you've actually brought that up.
yeah. I mean, I remember, way back when we were in internship and even at medical school, and later on the odd occasion when I did find myself in an obstetric ward, there were, 12-year-olds, 13, 14-year-olds that were in labor, that had delivered babies. So it's very important that the message is out there, that especially with the younger girls and the teenagers, that they do know that the importance of getting this regular screening done.
Yes. Can obviously I'm just talking because I have teenager. Can we talk again? The question came up yesterday about being on your cycle during that time. I mean, should you be going for a pap smear? Is it a waste? I mean, that's just knowledge that I would like to find out. I'm not sure if there's anyone else.
So generally speaking, I don't advise to do pap smears if you're menstruating at the time. But purely because additional blood and red blood cells could potentially obscure the smear. So it's always better to get a nice clean sample. I also, if a patient of mine has, for example, an acute vaginitis or an infection or a discharge, I try and treat that discharge first and then tell them to come back a week later, just to see, has the discharge cleared? And then also it's easier then to get a more a better sampling of the cervical cells if there's no discharge or infection involved. Obviously, the infections are picked up on the pap smear as well. So sometimes you have to just do the pap smear, even if there is a bit of an infection there. And then on the pap smear, it will be able to tell me whether it's bacterial vaginosis or chlamydia or something. And then I will know exactly what to treat the patient with. And it will also confirm the diagnosis that I would have made initially. But generally speaking, I would prefer to do pap smears when there's no menstruation and infection has cleared. But obviously, every patient, as I said earlier, is different. So I have to just gauge and see what's most appropriate.
All right. Well, from Hamadi's side, I mean, we do the bloods as well. So it's not just about the pap smears. We do the STI tests. We do all sorts of different other blood tests, as well as diabetes. And being that the population's got like 85%, I would think, is not medical aid and doesn't have medical aid, me being one of them, that we do have a cash price option, and we'd like to extend that no matter where you are, you guys have got the option of telling your doctors that, listen, we would like to use the Hamadi cash form, even if the doctor doesn't fully support. Eventually, we know that we will reach out and make depots exactly in communities that is needed. In depots, I mean that our nurses will be there. If the doctor refers for a pap smear or for bloods, I mean, there's no additional cost, but the actual just lab charge from us. So we just want to pay for the blood test. There's no fees to our nurses.
So, I mean, at our practice, our cash consult is 400 Rand, and that includes my consultation. That includes basic medication if I need to give you any. And then, obviously with a procedure like a pap smear, there is an additional charge, but it's literally just the lab fees. So, for example, if we're going to do your liquid-based cytology, which was, I think it was 175 Rand. No, how much is that? That's how much the LBC is, yeah. So that would literally be 575 Rand for my consultation and the pap smear altogether. I had a pap smear personally, I think in March this year, and the lab fees alone were 875 Rand, plus the consultation that I had to pay to the gynae. So it really is a fantastic drive that Hamadi Labs is doing in terms of making it affordable and giving this opportunity out there to women who wouldn't normally have access to it. So well done to you guys.
Thanks, Doctor. Right, from Hamadi's side, I have got to run.
I'm sorry that Zulfme, perhaps she had load shedding, I'm not sure. but I'm
Yeah,
sure
this load shedding. It's like every trip, every town I go to now today, it's like I just get into the load shedding show. But thank you, Dr. for your time. I will give you a call as well. Get some pap smears and stuff dropped off for you. And it was really lovely meeting you.
It was lovely to meet you as well. I've met some of your reps that have come to my practice, but it's nice to put a face to your name as well.
Shane, thanks.
I suppose to anybody who's watching, thank you for your attention, and I hope that you learned something. And if you have any questions, you can contact me at my practice. The number is 021 638 3135.
3135. Fabulous. Shaman, everyone can go to www.hamadilab.co.za and all our details are there. Thank you, everyone. Thanks, Doctor.
Take care. Bye-bye.
All right, bye.